Hello everyone, this class will learn the methods of examination. There are 4 diagnostic methods in traditional Chinese medicine, namely inspection, listening and smelling, examination, inquiry, and pulse-taking and palpation. They are quite similar to those 4 methods in Western medicine. Inspection means doctor purposefully observe the whole body or local regions of the patient in order to understand the pathological conditions. Listening and smelling examination means listening to the voice and smelling the odors imitated from the patient, as well as the secreta and excreta. Listening to the voice includes speaking, respiration, coughing, hiccup, sighing, and so on. Inquiry is similar to Western medicine. It's a method used to understand the occurrence and progress of diseases, previous treatment, present subjective symptoms, and other things concerning the disease by asking the patient or his companion. We have 10 question songs which summarize the content of inquiry. About symptoms, we can ask hot and cold, chill with fever or without fever. Ask sweat, spontaneous or night sweating, and we can ask headache, body pains, stools, and urine. Appetite, feeling in chest and abdomen, hearing, thirst, and fluid intake. And we also ask the occurrence and progress of diseases, previous treatment. For women, we ask menses. For children, we can ask measles and chickenpox. Pulse-taking and palpation are the method performed by pressing certain parts of the body to examine the patient. Pulse-taking is done the radial artery on the wrist to examine the conditions of the pulse. Palpation is done by touching, feeling, and pressing the skin, abdomen, by detecting the pathological changes. And among this, inspection and pulse-taking are key points for you. Inspection contains general and local inspection. General inspection includes the inspection of vitality, complexion, and physical build and movement. Local inspection includes the inspection of head and tongue. This class will focus on inspection of vitality and complexion. Inspection of vitality. Vitality is abstract but specific. It has broad definition and a narrow definition. In the broad sense, it's a general manifestation of life activities. In a narrow sense, it includes the state of complexion, expression, posture, speech, and consciousness. The expression of one's eyes usually gives the most important information of the condition of vitality. Vitality can be classified into 4 types, namely presence of vitality, lack of vitality, loss of vitality, and false vitality. Presence of vitality. The patient is conscious, eyes glowing with radiating vigor and moving freely, speaking clearly with quick response and behaving naturally. It means sufficiency of essence and qi. It indicates that illness is not serious and the prognosis is good. Lack of vitality. The patient has dispiritedness, low voice and no desire to speak, fatigue, and slow movement. It indicates illness is serious. Loss of vitality. The patient is listless, with a dull look in his eyes, slow in reacting, feeble in breathing, or even unconscious. It means exhaustion of essence and qi. It indicates the illness is very serious, and the prognosis is not good. False vitality. Critical patients may have transient improvement in spirit before death. He may have red cheeks, more talking, or good appetite, but they are transient. This phenomenon is like that the candle suddenly lit up before it went out. It indicates the separation of yin-yang, approaching death. Inspection of complexion. We observe the color and the luster of face and skin, which indicates the condition of qi and blood. Natural color can be affected by race, seasons, etc. And for yellow race, normal complexion is yellow with reddish, shiny and lustrous. We have 5 types of complexion: white, yellow, blue, red, and dark. White. It's a bloodless face or one with little color. It indicates indeficiency of qi and loss of blood. Patients suffering from anemia can have this kind of complexion. Yellow. The face is yellow without red. It means deficiency of spleen qi and dampness of the body. It's a sign of jaundice. Red. The face is redder than normal. It indicates heat syndrome. Blue. Bluish complexion is usually seen in severe pain, cold syndrome, blood stasis, and convulsion. Dark. This color is usually seen in severe and chronic cases of deficiency of kidney, blood stasis, and fluid retention. Okay, that's the end of this part. See you next class. Thank you.